So to start with, we'll go through a PowerPoint presentation and then we'll do a very fun activity. And by the end of it, I'm very sure that you will understand what is angioplasty, why is it required, and what is something that can be done to avoid any situation where one requires angioplasty. Okay, so let's get started. I'll share my screen with you. So prevention is better than cure. So nowadays, everyone around the world is talking about preventive healthcare, a situation where we can actually prevent ourselves from a situation where we would require any medical attention. So preventive healthcare has been gaining a lot of traction nowadays, especially after pandemic. So it's something that will increase in future also. So in today's session, we will understand when is angioplasty actually required, what is the procedure, different angioplasty techniques, what are some advantages and disadvantages, or we can call them drawbacks. So what is it that can be done to prevent angioplasty? What can it lead to if proper care is not given? And we will also understand the difference between the term heart attack and cardiac arrest. You may have come across these two terms. A lot of us tend to use these two terms interchangeably, but there is a lot of difference between these two. All right, so we'll do that. All right. So technology is something which has helped us human beings move ahead. It has helped us evolve. Now, a field that uses technology in medical field is called biomedical. Okay, so I hope you remember that term. Now, there is a picture on your screen. There is a depiction of a pipeline which is blocked. Now, if that situation arises at your homes, what will you do?
Obviously, you have to remove the block.
You'd have to call the plumber. The plumber will remove the blockage, and this pipeline would start functioning properly then, right?
Yes, sir.
Yes, sir.
Right. So this is, similar to what we are going to learn today. All right. So you call a plumber who will try to unblock it by removing the blockage. Now, imagine our bodies are also full of tiny little pipelines. We call them blood vessels. Okay. So our bodies are full of blood vessels. What will happen if there is similar blockage inside our blood vessels? What will we do? We'd have to remove the blockage?
Yeah.
Yes, sir.
All right. So let's understand this with help of an example. All right. So John is a 40-year-old business professional who drives to his office. One fine day, he felt a mild chest pain while walking up the stairs of his office, and he was also feeling quite dizzy. Okay. So I want you to take note of the symptoms. He's feeling dizzy. He's having mild chest pain. Now, 2 weeks later, he had a similar incident, but this time he fell unconscious. It was only after the diagnosis he visited a doctor and he was diagnosed with a blockage in his heart. Okay. All right. So what is the function of heart? What is the main function of heart?
It pumps blood.
Pumps blood.
Pumps blood. I want a more specific answer.
It oxygenates deoxygenated blood and pumps it throughout the body.
Right. So our heart is the main function of our heart is to carry oxygenated blood to different organs of our body. Now, the mean of communication to transport that blood is our blood vessels. Okay. So through blood vessels, our blood is able to reach different organs of our body. Now, obviously, if there is a blockage in one of these vessels anywhere in your body, that means your organs will not get sufficient supply of oxygenated blood. Now, what will happen then? If your organs do not get enough supply of oxygenated blood, what will happen?
They won't be able to function properly.
We won't be able to survive. Okay.
Yeah.
So our organs require a supply of oxygenated blood, and that is carried through our heart. All right. So walls now, our arteries has our blood has blood vessels. Our heart has blood vessels. Now it has arteries. The function of arteries is to carry oxygenated blood to different organs of our body. And we also have veins. All right. What is the function of veins? To carry deoxygenated blood
That's
back
right.
to heart. All right. So except pulmonary artery, all arteries carry oxygenated blood, and except pulmonary vein, it carries deoxygenated blood back to our heart. So it's a cycle which goes on. Now, if you look inside the walls of these arteries, which is inside our bodies, these are very smooth. Now, some people develop clogged arteries. Now, what you see on your screen is a depiction of a clogged artery. Can you see a yellow substance inside this artery?
Yes, sir.
Now, this yellow substance, which you see on your screen inside this artery, is called plaque. Now, because of this plaque built up, the oxygenated blood is not being able to move forward. Can you see that?
Yes, sir.
Yes, sir.
Okay. Now, this yellow substance is called plaque. Now, this is what which causes blockage inside our blood vessels. Now, again, there is a depiction of clogged versus healthy artery on your screen. Now, on top is a depiction of a healthy artery. And the second one, the bottom one, is a nearly completely blocked artery. Now, obviously, if there is a blocked artery, our organs will not be able to get the sufficient supply of oxygenated blood. And here is why we need healthy arteries, healthy blood vessels inside our bodies. Now, we've understood that this blocked artery is caused by the buildup of plaque. Now, how does it happen? How is actually plaque that comes inside our blood vessels? Now, it's because of building up of fat and protein inside the inner walls, in the inner walls of our arteries, which results in its hardening. So over the time, as fat and protein accumulates inside our arteries, it gets hardened over the time. Now, heart attack is something which occurs when there is a complete blockage, right? So heart attack is something that occurs when there is a complete blockage in the arteries. Now, over the time, over the plaque, a fibrous cap is formed, which ruptures and results in formation of clots. Now, because of these formation of clots, it leads to complete blockage inside the arteries. Clear?
Yes, sir.
All right. So it starts with building up of fat and protein, and it subsequently gets converted into blood clots, and that is what leads to blockage in the arteries. Clear, everyone?
Yes, sir.
Okay. Any confusion up till here? Anyone? All right. Now, every disease, most of the disease, as a matter of fact, have some symptoms. Okay. Like COVID-19 has symptoms. What are the symptoms of COVID-19?
Fever, cough.
Fever. Yes. All right. So most of the diseases, in fact, have some symptoms. If we are able to catch those symptoms and treat that disease in its initial stage, it doesn't become life threatening. Unless, on the other hand, if we wait for a very long time, then these symptoms, get converted into a very serious situation. All right. So what are the symptoms of a clogged artery? Now, when the plaque gets built up, it narrows the arteries. As you see in the pictures, in the previous slides, when there is plaque built up inside the arteries, it narrows down the walls of the artery. Now, what it does is it decreases blood flow. If the blood flow is decreased, our organs which are there inside our body, will not get their supply of oxygenated blood. Okay, so this is the second symptom. Third one is chest pain, which we also call angina pain, shortness of breath, and other coronary disease symptoms. So these are broadly the symptoms of a blocked artery. Clear? Right? Moving on. Now, if we have a clogged artery, we would need to unclog it. Now, these blocks which are there inside our arteries have to be removed. Now, the process which is there through which we unclog the artery is known as angioplasty. Right? Now, there are many types of angioplasty, different techniques of angioplasty which are used. So, in today's session, we'll explore a little bit of different techniques and procedures. All right, so for now, let's do our activity. Now, this activity is called Let's Unclog. Okay, so the objective of the activity is to remove the blockage inside the pipes. I hope everyone has the prerequisites.
Yes, sir.
All right,
Yes,
so
sir.
we will try to remove the blockage in the pipes using different techniques. And this experiment will make it easier for you to understand the procedure which we follow in a real angioplasty. Okay, so for this, we require two to three pipes. We require some dough or clay, and we require a surgical glove or a balloon. Okay, let's get started. Now, I have these two pipes with me. Similar ones?
Yes, sir.
All right. Now, if you look inside each one of them, you will see a difference. Now, in this pipe, which is in my right hand, I have put some wheat dough inside it, and it is a depiction of a clogged artery. Can you see that? And this,
Yes,
on the
sir.
other hand, in my left hand, is a depiction of a healthy artery. Okay, so can you see the difference?
Yes, sir.
Okay, so what we'll do is we'll take these two pipes and we'll insert wheat dough inside one of them, and then we'll try to remove that blockage through what we are going to do today. Now, what we'll do is we'll take some dough or clay. Okay, so we'll take some dough, or if you're using clay, you can use clay. Now, what we'll do is we'll put some of it on one of its end and some of it on the other end of this pipe. Okay, done. Okay, can we move on? Next steps. Now, what we'll do is we'll take any object like this. You can take an empty pen body. Now, what we'll do is we'll take it through this pipe and swirl it around a few times like this. Now, if you swirl a pen around inside your pipe a few times, it will look like a clogged artery. Can you see that? Okay. Uh, has everyone done this step up till here? Yes, no? You can show me a thumbs up on your Zoom.
Almost.
Yeah. Okay. All right. Now, what I want you to do is, we'll take any object like this. You can take a pen refill or you can take a metal wire. Now, I want you to observe what happens when I pass this little piece of straw through this pipe. Now, do you think it's been able to remove any blockage?
Yes, sir.
Yeah, I want you to insert a metal wire inside this pipe and see if a metal wire is able to remove any blockage. It doesn't help?
Yep.
Okay. All right. Now, what I have here is a pen. Now, what I will do is I will again insert this pen in this pipe and take it out from the other end. Yes. So, do you think this pen is a helpful tool to remove the blockage?
Yeah, but
It has actually taken out some of the, blockage, but most of the plaque buildup inside the artery is still there. Okay. So, if you're a doctor and you were to remove the blockage, you would obviously remove the whole blockage, right? Or just tiny part of the plaque,
whole thing.
right?
The
So
whole
if you want to be a successful doctor, you'd obviously have to remove the whole blockage. Now, how can we do that? Now, we have this surgical glove with us or a balloon. Everyone has it? Okay. Now, what we'll do is we'll pass this surgical glove through this pipe like this. With help of a pen, you can do it with help of a pen. Okay. Yeah, we'll take it inside and through this pipe. Yeah. So this is how it looks like. Yes. What do you think is the next step? Hmm? No, I hope everyone's room smells like a bakery now with all the dough and everything. All right. So what we'll do is now in this end of the balloon or the surgical glove, we'll blow some air. Now, after it's inflated like this, we'll pull it out. Yeah, do it again. Yeah. So, do you think this is a successful method to remove the blockage?
Yes, sir.
Has everyone done it? When I insert this balloon and take it out from the opposite end, it removes the blockage from this artery, the pipe which we are using. Now it removes the blockage. Now give me 30 seconds to clean up my table while you do this activity. Okay. Okay. Yeah. So out of three methods that we used, which one do you think is most efficient?
The one with the balloon.
The one with balloon, right?
Yes, sir.
Okay. So this is the procedure which is actually involved in a real angioplasty. Clear? Now, has everyone done the activity? Or is there
Yes,
anyone
sir.
who's still doing it?
Sir, my gloves has a hole, so I can't blow
Okay.
air.
So
I
your
noticed
equipment
it.
has a flaw. So you'll be a, unlucky doctor. Can't help it. All right. So I hope everyone has understood the purpose of this activity. We had two pipes. We had inserted a little dough inside one of the pipes, which is again a depiction to understand how a clogged artery looks like. Now, first instance, we used a metal wire or anything similar to metal wire. We passed it through the pipe and it was unable to remove the blockage. Now, on second instance, we used something with more circumference. We used a pen. It did remove some blockage, but a majority of the blockage was still sticking to the walls of the pipe. Now, on third instance, we had used a balloon. We had inserted a balloon through the pipe and then we pulled it out. Now, along with that blockage, along with the balloon, the blockage which was sticking to the walls of the artery had come out. Right. So, out of the three methods, the balloon obviously was the most efficient method to remove the blockage. And this is actually the real. This is what real angioplasty also entails. Clear, everyone? Okay.
Yes,
Let's
sir.
go back to our presentation. Yes. Why do you think that the metal wire, the first tool to remove the blockage, was not a good method? Hmm?
Because it was thin.
Because I did not remove it.
Okay. Yeah. It was not a efficient tool to remove the blockage as it was very thin. Again, a metal rod or a pen is not a good method. For the same method, because of the same reason, because the plaque was still sticking to the walls of the artery. Now, what had happened in case of balloon is we had put a balloon through the pipe, and we blew some air into it, and then we pulled it out. Now, along with the balloon, all the plaque was sticking to the walls of the artery had also come out. Hence, we can say that the balloon is the most efficient method to remove the blockage. Okay. Now, up till here, we've learned about unclogging arteries and the importance, balloons' efficiency in removing blockage, and inefficiency of other methods in removing the blockage. Now, let's understand something about the procedure of angioplasty. Now, again, there is a picture on your screen, and you see a tiny mesh, a metal mesh Now this mesh is known as a stent. What is it called?
Stent.
Stent.
A stent. Okay, it's a mesh coil. It's known as a stent. Now another thing you have to keep in mind, a catheter. So catheter is a thin tube which is inserted into a blood vessel and guided to a blocked coronary artery. Okay, so catheter again is a thin tube which is inserted into a blood vessel and guided to a area in blood vessel where you have the blockage. Now on tip of this catheter we have a balloon. Okay, now on the tip of this catheter we'll put a balloon. It's the similar procedure that we have done in case of the pipes, and it's a very low risk procedure. And what can happen is it can result in some bleeding at a site where catheter is injected. Now, this is the first type of angioplasty. It's known as balloon angioplasty. Now, it uses a tiny balloon. There are two pictures on your screen. Now, this is a catheter. Can you see a catheter? And the yellow substance again is plaque. Is clearly a depiction of a blocked artery. Now, on tip of this catheter over here, you have a balloon. In the second picture, you'll be able to see it clearly. Okay, so this balloon over here, which is attached to the catheter, is removing the blockage from the artery. Can you observe the change between these two?
Yes, sir.
Yes,
Okay.
sir.
Now, this is how balloon angioplasty works. What we did as part of the activity is similar exactly what happens in case of a angioplasty. Now this catheter is inserted in a blocked blood vessel to widen it, and it also improves the blood flow. Now coming to the second type of angioplasty, which is called balloon stent angioplasty. Do you all know what is stent? I asked you to keep this in mind while we were discussing angioplasty procedure. A stent is a tiny expendable metal mesh coil. Okay. So in type 2 balloon stent angioplasty, we have a normal balloon which is attached to a catheter. Now on top of that balloon, we have stent also. Clear? Now, where does stent help? It helps to keep and to make sure that the artery remains open and there is less chance of narrowing down of arteries. Now, if there is a bigger blockage inside the artery, this balloon stent angioplasty is used. Clear? Okay. Now,
Yes,
who'll quickly tell me the difference between the type 1 and type 2 angioplasty? K. Kirti Vasan.
Yes, sir.
Yeah. What's the difference between the type 1 and type 2 angioplasty?
In type 1, a stent is not used.
Correct. So only difference that is there in the second type of angioplasty is that along with the catheter and balloon, we are using a metal mesh, which is known as stent. This is the third type of angioplasty. Sorry, the second type. Clear?
Yes, sir.
Okay, now coming to the third type, coronary bypass surgery. Have you heard of this term? You may have heard it. Okay. Now what happens is in this coronary bypass surgery, blood flow is redirected when blood vessel is partially or completely blocked. Okay, so say for example, this is a blood vessel. Okay. Now imagine from here to here, there is a blockage inside this artery. Okay. Now from this point to this point, there is a blockage. Understood?
Yes, sir.
Now, in coronary bypass surgery, what we will do is we'll take out a healthy blood vessel from anywhere in your body, and we will attach that healthy blood vessel and redirect the blood flow uh, bypassing this blocked part. Now we'll attach a healthy blood vessel from here to here, bypassing this blocked part, or part which is not functioning properly. Now this is known as coronary bypass surgery. Clear? I'll repeat it for you. So if for this little part in the middle of this blood vessel is blocked, we'll take out a healthy blood vessel from your body, from your leg, arm, or chest, and we'll attach it bypassing this blocked part. Now, what that will do is it will redirect the blood flow, and it will avoid going through the pathway where you have a blockage inside this artery. Right? So this is the procedure which is involved in a coronary bypass surgery. Clear? All right. So it improves blood flow to your heart muscle. Now the procedure involves taking out a healthy blood vessel from either your arm, your leg, or chest, and connecting it beyond the blocked arteries in your heart. I hope it's clear to everyone.
Yes, sir.
Yes, sir.
Okay, fine. Now, what can we actually do, to make sure that one does not reach a point where one would require angioplasty? Okay, no one would like to, go through that procedure. Now, what we can do is to maintain a healthy diet, maintain a healthy, balanced diet, consume healthy, balanced diet, proper balance between carbohydrates, fats, proteins, vitamins, and minerals. The first thing is to consume a healthy diet, avoid trans fats, something like Kentucky Fried Chicken, or whatever your food chains, Burger Kings, cookies, anything which has excess trans fats is to be avoided. Third thing is to cut down on sugar. Okay, so there has been a lot of research going on across the world, especially with regard to white sugar, that it is more addictive than cocaine. So cocaine is a drug which is banned, and it is very addictive, but white sugar is more addictive than cocaine, and it's not good for your body. So instead of white sugar, you can consume natural sugar like jaggery, palm sugar, or date sugar. So there are alternative to white sugar. So if you can just completely take out white sugar from your diet, avoid junk foods. Probably once in a while you feel like going out and having a burger and Coke. It's fine, but you make sure that you don't become dependent on junk food. It doesn't become an addiction. And lastly, exercise regularly, at least for 30 minutes. Aerobics, where your heart rate goes up. What it will do is it will keep your body healthy. It will prevent you from becoming overweight. It will prevent your heart from becoming unhealthy, or your internal organs, and you will feel, you'll be able to focus more on your studies actually if you exercise regularly. Okay, how many of you actually do exercise regularly or play?
Yeah,
I do play,
I do.
sir.
What do you all play?
Badminton.
Yeah, it's a good exercise. Also, badminton. What else?
I sometimes I try to do this aerobics thing, and if I can't, like, I walk. I go for a
Aerobics.
walk.
Okay, walking. Is there anyone who runs?
Sir,
Any
while
runner
playing,
over?
I run.
Fine. Is there anyone who does a long distance running? 5-10 kilometers? No? Okay, fine.
My max
So running
is
is
4 or 5.
actually, what's that?
My max is 4 or 5.
All right, that's good. When I was in school, I could barely manage to run 1 kilometer. Right? So fine. So running is a kind of exercise, for which you don't require any companion. All you need is some shoes. You go out, and it's really the best form of exercise, and it's a very healthy practice if you include it in your daily lifestyle.
But now in
So
this
exercise
situation,
regularly.
it's really hard to go out, and then when you go out, you have to wear your mask, and then it's hard to run while wearing your mask.
Exactly. So one of the downsides of living in cities is that you have very cramped and limited spaces to go out and exercise. All right. So yes, but never mind if you still have little balcony in your house, you can go there, and there are exercise programs, available readily available on internet, for which you require a very limited space, and you can still exercise and keep yourself healthy. Okay, so I would urge everyone to exercise at least for 30 minutes even during your exams. All right. Okay, let's go back. So these are the points that one needs to keep in mind. Now you may have heard of this word cholesterol. Okay, cholesterol. Yes, no.
Yes, sir.
Okay.
Yes, sir.
So, cholesterol is a wax like substance which is actually necessary for our body. Some of cholesterol, some in its healthy limits, is required by our body to make hormones, and too much cholesterol is something which will lead to floating of vitamin D inside the blood vessels. And what it will do is it will increase the levels. Excess levels of cholesterol will lead to it sticking to the walls of blood vessels, and that is something that will lead to the blockage in your blood vessels. So this is about cholesterol. Now, coming to your home activity, the first part of your home activity is research at home. Now, firstly, what you'll do is, the other way to treat blocks is to do a bypass surgery. You'll do a research on what is the procedure of this bypass surgery. You can take help from your tried and tested Google. But when you research, I want there is something called Google Scholar. How many of you use it? So if you type Google Scholar, it will redirect you to another Google platform wherein you can actually read the articles written by scholars or the experts in their own fields. So it's a more academic form of Google. So if you go on Google, just type in Google Scholar, and there you'll find more academic articles. I want you to give this a try and conduct a research on the procedure of bypass surgery. Secondly, look into how you can maintain a diet that will give your body what it needs while lowering the risk of blockages, and create a food plan based on it for 1 week. Can you do that? You get to become dietitians.
Yes, sir.
Anyone who creates a food plan? No one? Okay, fine.
No, sir.
Okay, so as second part of your home activity is innovate at home. Now, in 50 years' time, how do you think the procedures of angioplasty will have changed? Now, everything goes through evolution. In our session of digital stethoscope, we had a look at the evolution which happened with regard to stethoscope. It was a wooden piece to start with, and now what you see is a completely different form. So it's because of innovation. We understood what is innovation in our first session. So I want you to be your innovative best and answer this question: how do you think the procedures will have changed in 50 years time? Now, the format of your home activity is to be submitted in a format of PDF or Word doc, whichever you feel comfortable, and please send it in the WhatsApp group. Okay. Now let's discuss some of the future. Now we'll have something called drug coated balloon. So everyone knows what's the purpose of balloon in angioplasty.
Yeah.
Now what we'll do in this particular procedure is we'll coat the balloon with some drug, with medicine. Okay, so drug eluting balloons are balloon catheters that are coated with a drug. When pressed into artery wall, the drug, the medicine which is there on the balloon gets smeared onto the walls of the arteries, and it prevents the delays the growth of scar tissue. Stent at bends. Now in the near future, the stents will be focused on finding methods to treat blockages in flexion points. So there is an example, a picture over here. A flexion point is depicted on your screen. Now if there is a flexion point in the blood vessel, it becomes very difficult to perform angioplasty. But a lot of research is being going on with regard to stented bends, so that angioplasty can be done easily even at the bends. Now that is all for today's session. It's been a comparatively short session, right?
Yes,
I
sir.
hope you
Yes,
all
sir.
enjoyed the activity.
Yeah.
Yes, sir.
All right. Yes. Any questions? Any confusion? Any questions? So how many of you are actually planning to submit the home activities?
So I will.
I will,
Okay.
sir.
Very reluctant. I will. Never mind. Okay. So whatever home activities are there, they're there for your own better understanding of the concept. Okay. So if you put in some 10, 15, 20 minutes of research or hard work into whatever we have studied in the session, your concepts will become more clear. So that is why we've included home activities. And that is why we call it home activities and not homework. It's not something which is mandatory, but we want you to do it because it will always increase your own knowledge about whatever we've learned in the session. Right? So I'll see you next week, everyone. Next session is about digital portfolio. It's going to be a very interesting session. Okay. So till then, take care and see you soon next week. Goodbye.